Welcome to HIV Community Link online e-learning presentation on new prevention technologies changing the prevention landscape. Our mission is to reduce the harm associated with HIV and AIDS and hepatitis C for all individuals and the communities that we serve. Our 4 pillars of operation include testing, stigma, harm reduction, and health promotion. It is a fact that 1 in 4 Canadians living with HIV do not know that they are HIV positive. This may be one of the leading causes for transmission and new infections as a result of not being tested and knowing one's HIV status. Most recently, the Public Health Agency of Canada estimates that there is 1 new HIV infection in Canada every 3 hours. It is important to note that all sexually active persons should be tested for HIV and other STIs, regardless of gender or sexual orientation. There are a number of well-known and established methods that have been proven to be effective in reducing the risks associated with HIV, hepatitis C, and other sexually transmitted infections. Abstinence is a known and proven method to prevent HIV and other sexually transmitted infections. Universal precautions and blood product safety, such as using gloves, sterilization and proper handling of waste and biohazardous items, including syringes, are key components in reducing risks in the workplace, including our schools and daycare settings. Condoms, lubricants, and barriers, such as dental dams, have also been proven as effective methods for preventing the transmission of many sexually transmitted infections, including HIV. Treating present sexually transmitted infections, such as syphilis and chlamydia, are important as the presence of these sexually transmitted infections can significantly increase the risk for HIV transmission. A combination of these and other strategies can also lead to a decreased risk of exposure to and/or infection with HIV or other sexually transmitted infections. Universal precaution and blood product safety are well-known and established methods that have proven to be effective in reducing the risks associated with exposure to and infection by HIV, hepatitis C, and other blood-borne pathogens. Universal precautions and blood-borne product safety can include the wearing of gloves, using clean needles and equipment, regular washing of hands with soap and warm water, the proper disposal of medical waste, and the proper sterilization of surfaces and countertops with disinfectants or cleaners known to kill the HIV virus. It is important to note that bleach has not been shown effective in destroying the hepatitis C virus. There are a number of types of barriers and devices known to prevent HIV and other sexually transmitted infections. Male condoms come in a variety of options, including lubricated, non-lubricated, latex and non-latex, varied sizes, styles, flavors, and colors. The female, or insertive condom, is a polyurethane product that can be inserted up to 6 hours prior to sexual intercourse and provides an option for women who may have partners who cannot or will not use male condoms for a variety of reasons. Dental dams are an option to consider when practicing oral sex or any sexual activity where the mouth may come into contact with the vaginal or anal fluids. This layer of latex acts as a barrier between the two and can enhance pleasure when properly lubricated on the side touching the vulva or anus. Lubricants are available in a number of types and flavors that are latex condom friendly to reduce breakage. It is very important to never use a petroleum-based lubricant, such as hand creams, Vaseline, or other lotions, as these are known to break latex condoms. Safe lubricants are either water-based or silicone-based and will be clearly indicated on the package. It is strongly recommended that condoms and proper lubricants be used for all penetrative sexual activities, including the use of sex toys such as dildos and vibrators. The use of lubricants greatly reduces the friction and possible tearing that may occur during sexual activities, thereby reducing the risk for HIV acquisition. Some other lesser-known prevention strategies include options such as serosorting or choosing partners of the same HIV status, be that positive or negative only partners. strategic positioning for sex, where a person may choose to either top or bottom based on status and possible level of risk based on sexual activity and the comfort of the persons engaging in the activity. Safe and proper use of sex toys such as dildos, vibrators, and other stimulators by using condoms and lubricants will also reduce risk of exposure to HIV and STIs. Fantasies and fetishes, including BDSM and other non-penetrative and non-body fluid transfer, can also reduce the risk and exposure to HIV and STIs. Using proper water-based or silicone-based lubricants to prevent tearing, rashes, or condom breakage will also reduce risk. If a person is HIV positive, having an undetectable viral load while on treatment has also been shown to significantly reduce the risk of HIV transmission from a positive person to a negative person. This is also known as treatment as prevention, or TASP. Some of the new and emerging technologies to combat HIV infections and transmission are voluntary medical male circumcision, microbicides, vaccines, post-exposure prophylaxis, or PEP, treatment as prevention, or TASP, and pre-exposure prophylaxis, also known as PrEP. So what is voluntary medical male circumcision? Voluntary male medical circumcision is the removal of a male's foreskin. It is a widely used, simple, and safe procedure. Men can be circumcised at any age. VMMC can provide protection against HIV infection. A circumcised man is up to 60% less likely to acquire HIV than an uncircumcised man because the inside of the foreskin is soft and moist and is more likely to get tears or sores that allow HIV to enter the body more easily. The foreskin itself contains many target cells that allow HIV to enter the body easily. After circumcision, the skin at the head of the penis becomes thicker and is less likely to tear. VMMC reduces the man's chances of getting other infections like syphilis and chlamydia. VMMC also provides some protection against penile cancer in men and cervical cancer in women. Someone considering VMMC should know their HIV status in order to get the health benefits that VMMC provide. Clients who decline the test but still want to get circumcised must be respected for their decision. VMMC is not recommended for HIV-positive men. The procedure takes a short time. An injection is given at the base of the penis to make it go numb, so that no pain is felt when the foreskin is cut off. The wound is then stitched, cleaned, and bandaged. The man rests a short while, and then goes home. Important to know is, after 3 days, the bandage is removed. He cannot have sex for the next 6 weeks. For the next 7 days, it is important to keep the wound clean and avoid heavy exercise. After 7 days, the man needs to return to the health facility for a checkup. If men experience any complications after surgery, such as prolonged pain or bleeding, they should seek assistance at their local clinic.